right, so Dr. Sutter, take me through, I guess, the last couple of weeks. I know we talked to you last week about the increases in the positivity rate, case numbers, even the number of deaths we're seeing in Allen County. But now this is the first time really that this public warning from you is kind of stressing the situation we're in. So talk to us about what you're seeing right now in the county.
Yeah, so we continue to see cases go up. Our daily average of cases is now about 200. So as you remember, in the middle of June, we were below 10 a day on average, and now we've seen a 20-fold increase in that. We're also seeing an increase in hospital admissions, and the hospitals are starting to feel the strain.
Those hospitals, and I'm assuming you're speaking to them daily about the numbers that they're seeing, the ICU beds. Is there any problem right now in terms of hospitals either getting towards that breaking point, getting towards that maximum capacity that a lot of hospitals around the country are struggling with right now?
So we're not seeing things like what they're seeing in Florida or Louisiana right now, but the hospitals are very full. It's a different situation than in the fall because then they weren't seeing a lot of other sick patients. Now they're seeing a lot of sick patients with things other than COVID, but now we have the COVID on top of that. That combination is creating quite a strain.
And that strain, obviously, this feels a little bit more similar to what we saw over that last winter period when we saw positivity rates really explode across Allen County and Northeast Indiana, the state, the country. Are we heading towards that direction right now? Is there any indicator that we're, either going at a kind of a gradual pace of increase, or is it more exponential? What are you expecting in the next couple of weeks?
Yeah, so we're following those trends closely. We've actually seen a little plateauing of admissions over the last 7 days based on in this district. However, some of the hospital's internal modeling says in the next couple of weeks they could be in real trouble. It's hard to say because we've got a higher rate of vaccination, especially over 65. We don't know exactly how our cases will translate into that, but the hospitals are certainly concerned.
That increase in, or I guess the plateau that you're talking about right now, are we starting to see any sort of an increase in the vaccine numbers in Allen County or in Indiana? Are you surprised at vaccine numbers? Talk me through some of the vaccination numbers you're seeing right now.
Yeah, so we're seeing a slow increase in vaccination. Okay. I think as people are starting to recognize this trend coming. Today the FDA announced a formal approval for the Pfizer vaccine. A number of people have said that's the thing that they were waiting for, so I expect vaccinations will go up with that. And then, around the country, we're starting the third dose series for people who have problems with their immune system. So that's a fairly small number of people, but that will be additional doses too.
And part of your advisory today wasn't just, putting those cases down in the hospitals, but it was also about wearing masks inside, particularly for all age groups of kids in schools, especially. What have your conversations been like with superintendents, school leaders across the counties? Fort Wayne Community School, they are requiring it, but some are still mask optional right now. What have your conversations been like?
Yeah, so they're all concerned, and we're concerned too that we may see in-school transmission or in-class transmission. One of the main things we want to do is trying to keep schools open for in-person learning. It's really valuable for the kids. I'd like to keep the schools open. What we learned last fall and throughout the last school year was that when kids were masked, even when they were in somewhat close, they didn't tend to spread COVID-19 through the classrooms. However, we're embarking on an experiment right now to see whether kids will transmit it without masks. My guess is they probably will, but we'll learn that shortly.
And do you see, especially with some of the stories that we're hearing about in, I think it was Missouri and Arkansas, basically schools shut down after the first week. Could we expect to see something like that similar happening here? Just with the amount of cases that we're seeing increase, the amount of positivity, the positivity rate, I think in Allen County is close now to 12%, which is something we haven't seen in a long time. Could we expect to see something like that?
So our positivity rate right now is 13%. as of today. Once it goes to 15%, we would be in red from the state's perspective. We are seeing a tremendous amount of community spread. When we talk to our contact tracers, it's really everywhere. It's not just one spot. It's not localized outbreaks. There is lots of COVID-19 out there. What we are trying to do is stop that chain of transmission. And we can do that by social distancing, by wearing masks, or by staying away from each other. The simplest thing is if you're going to be indoors in close proximity is to wear masks.
I know we've talked about this before too, about the decision, who has the decision and who, should be giving that decision to mandate masks, whether Governor Holcomb saying it should be a local decision. I think you've talked to me about this before, saying the governor really should be mandating these masks or giving more, cause towards what businesses and what areas, what places should be having masks. Does that change right now? Do you think that either state government or federal governments should be more in the decision-making process of who and where is, mask determined? Or do you see yourself making that decision soon if that positivity rate continues to increase?
Yeah, so one of the things we'd like to do is use the lightest touch possible to get us through this. The key point for me is really our hospital systems and our healthcare workers. Our healthcare workers are fatigued. They really haven't gotten over the last surge from last fall, and a number of them have left the bedside. So it's increasingly harder to get people who can take care of COVID patients. And that's going to be our step in the hospitals that limits us. What I'd like to do is have people show personal responsibility. It's clear that business owners can mandate vaccinations for their staff. They can mandate masks. School boards can mandate masks for their schools. When governor intervenes, it gets more difficult. And while it would be nice if there was a state mandate like what there was last fall, we're not seeing that right now. Again, there is the potential to have a local mandate. And if we start to see the hospital system in real trouble, if things are really out of control, that's an option, although any order that I write has to be approved by the county commissioners, which makes things more difficult. So we'll just have to see how this plays out. I mean, we're looking at Florida right now with no restrictions. They've used up almost all their ICU beds in the state. We don't want to be like that.
Yeah, and I know, especially speaking on Florida, there's school districts, some of those southern Florida counties, I mean, schools basically have to be on pause for 2 weeks because, we're hearing, 6,000, 7,000 kids are in quarantine and stuff like that. Do you think, especially the way it has gone, I mean, really since the beginning, the politicization of masks, of vaccines, of the whole pandemic has made it harder for health officials and has made it harder for citizens to kind of push through this?
Yeah, it's certainly been a case where we've not pulled together as a country where a number of other countries have. It's a global pandemic and it's a brand new virus. So we expect it to be difficult. We expect that there's going to be twists and turns along the way. But I don't know that we've done a good job of coming together to find solutions. Instead, we've become polarized and separated. So, my job is to do the best I can as a medical professional to try and navigate us through this without overwhelming our healthcare system. Ideally, I'd like to keep kids in school. Those are difficult, doing the best we can to get through this at this point.
Gotcha. Unless I missed anything, I know I just asked like 5,000 questions in about 5 minutes, but unless I missed anything, if you got anything else to add, I don't know if there's another point that you want to be made or something else you want to warn the citizens here in Allen County about.
So, the one bright point remains the vaccines. We weren't sure whether we could develop vaccines this quickly, and we're lucky to have 3 safe and effective vaccines. One of them is now approved with full approval by the FDA. So if people are worried about that, that's an additional step towards getting people vaccinated. There have been hundreds of millions of doses of these vaccines given. This is one of the most scrutinized rollout of a pharmaceutical in the history of the world. There are some significant side effects, which are extremely rare, and then there are common side effects, which are very mild. The vaccines aren't perfect. They don't completely protect you from COVID, but what we're seeing is the vast majority of the hospitalizations and deaths are when people are not vaccinated. So it's like wearing a seatbelt. It doesn't keep you completely safe in a crash, but boy, that's something you want buckled up if you happen to crash your car.